Tonight, all that physical distancing may be starting to work.
I'm starting to see some glimmers of hope.
Signs of progress in bending the curve, but also a warning. The battle against COVID-19 remains critical. Canadian airline crews falling sick with COVID-19. Is enough being done to protect those essential workers in the sky? CBC News investigates. Keeping Canadians on the payroll.
I said to my team, I will pledge to pay you.
What Ottawa's new wage subsidies mean for small businesses on the brink. And Canadians heading out of town to isolate. Could all those visitors tax small town hospitals? This is The National. In just days, our country has been transformed. Schools suspended, businesses upended, travel disrupted, all to hold back the dangerous spread of COVID-19. And tonight, a glimmer of hope that all of this might be making a difference.
I'm trying not to overcall it, but I do believe we've seen a flattening, a falling off of that curve.
BC's public health officer presented models of the progression of the disease in this province, BC, among the first to enact physical distancing measures and asking travelers to isolate. And there are signs of a positive impact. But dive into the numbers like Vicadopia did, and the main message remains clear. We are not out of the woods, and we need to keep our distance.
The advice to keep our distances has made for strange scenes across the country, Canadians adjusting to life farther apart, all to interrupt the spread of COVID-19. Is it working? BC is showing some positive signs, at least according to the latest reported numbers. When looking at COVID-19 cases per million, this is what the province's trajectory was. But here's where the province is as of Wednesday. The number of new cases has halved, though it may be too soon to call it progress.
I'm starting to see some glimmers of hope, if we will, that we've flattened out. Our increase, our trajectory has leveled off a bit. We need to see that continue.
Ontario is inching towards 1,000 cases, including 3 more deaths. Still, there is a hint of an encouraging sign.
I was anticipating that our number would be higher than 170, so I am pleasantly surprised it's 133. I would say that's okay. Let's see where we go. It's only one day.
Compared to 2 hard-hit regions, Canada's caseload is not climbing as quickly as Italy and Hubei province did. But it's not time to ease up on the isolation measures.
We're in it for the long haul. It's not going to be days and weeks, it's definitely months.
So much of that depends on us all doing our part to keep this from going explosively.
More than 90% of the assessed cases in Canada don't need hospitalization, and that's just known cases. It's actually those people with mild or no symptoms that add an unpredictability to the equation.
They feel healthy, they're walking around, they're contacting others, they're going to the store, and so they're creating secondary infections without even realizing that it's happening.
The answer is now all too familiar to Canadians. Stay apart, stay at home. Vicadopia, CBC News, Toronto.
A bright side in the numbers Canada-wide is hard to see tonight. The death toll has risen sharply. 55 deaths now linked to COVID-19, up more than 30% from yesterday. The biggest surge is in Quebec, reporting 10 new deaths. Across Canada, more than 4,700 have tested positive for the disease. 714 of those cases new today. It's worth noting that is similar to the daily increases we've been seeing all week. Well, for some analysis on this, we're joined by infectious disease specialist Dr. Isaac Bogosh, and very carefully nuanced statement here from British Columbia. What do you make of it?
I think it's extremely appropriate that there were carefully worded statements there. It's too early to be cautiously optimistic. Certainly, we all hope this is headed in the right direction, but it still means we have to keep our foot firmly on the gas pedal, practice our physical distancing measures, broadly test individuals, and of course, isolate and support people who are positive or exposed to positive cases.
What should we expect across the country in the next week or so?
Certainly, if other parts of the country have been practicing the same physical distancing measures and have expanded their testing programs, then we can hopefully start to see the curve flatten. Of course, we know we're having different epidemics in different parts of the country, and if we're having success in one part of the country, it might not be the same in another part of the country.
But for now, of course, restrictions remain in effect, and some provinces are getting even tougher, and we'll see whether this glimmer of hope is in fact going to play out. Dr. Bogosh, thank you very much.
Oh, thank you.
Despite these restrictions that Canadians are enduring, there are limits and exceptions to physical distancing. Workers who won't or can't stay home. Flight attendants who have to deal directly with travelers, construction workers ordered to stay on site, and those who work with our food and grocery stores, contact seems unavoidable. And as Stephanie Matisse tells us, leaves them vulnerable.
Katie Saunders called her husband Keith her soulmate and angel. She wrote on Facebook that she's doing her best to try and navigate this nightmare. Keith Saunders had COVID-19 and died Wednesday at the age of 48. Saunders was an employee at this Real Canadian Superstore in Oshawa, east of Toronto. He hadn't been traveling like a growing number of COVID-19 patients in Ontario.
To me, this is evidence of community transmission. Is it community-wide? No. People should know that it's very important to keep the social distancing.
But physical distancing can be difficult for those working in grocery stores, and a few infections have now been reported. Last night, the grocery chain Longo's reported a worker in Woodbridge, north of Toronto, had tested positive. A driver for the chain's delivery branch, Grocery Gateway, is also infected. Longo's says customers who received deliveries from that individual in the last 2 weeks have been notified. Keith Saunders last worked at the Real Canadian Superstore on March 16th. And the local health authority says the risk of transmission to customers is very low. Still, some people are understandably worried about workers and about their own safety when they're shopping for essentials.
To decrease your risk.
This video on how to handle groceries in the age of COVID-19 has been viewed more than 13 million times.
Because I know that human hands have touched this medication bottle in less than 72 hours, I'm going to wipe that down.
But the U.S. Food and Drug Administration says currently there is no evidence of food or food packaging being associated with transmission of COVID-19. The advice from health experts, if you're concerned, wash your hands when you come back from the grocery store and after removing food packaging. Stephanie Matisse, CBC News, Toronto.
Air Transat has announced 6 new special flights beginning Sunday to bring back Canadians stranded in southern destinations. But CBC News has learned more than a dozen crew members at Canadian Airlines are sick with COVID-19. As Dave Seglin shows us, that is prompting calls for change.
Air traffic, much of it now grounded, but still some flights are repatriating Canadians, and domestic flights continue, risking community spread. Yesterday, one flight attendant in the U.S. died from COVID-19. CBC News has learned that more than a dozen here in Canada are sick. 7 cases at WestJet, Air Transat, 4 flight attendants, 1 pilot. Air Canada won't say, but we've learned there are many clusters in the West, including Calgary, where 1 member has been released from intensive care. This flight attendant is still flying, but is afraid.
Because we are in the front line and we are exposed to people from all around the world. We have connections from all over the world to come home. I've asked several times why we are not wearing hazmat suits. Other airlines are wearing hazmat suits.
Ukraine International Airlines is now outfitting all crews with these. Canada's airlines right now are providing gloves and masks, but they're voluntary.
We don't have properly fitted N95 masks. We don't have properly fitted gloves. And we don't have things such as disposable long-sleeve isolation gowns.
In a statement, Air Canada said, "We are now making N95 masks available to our flight crews. We remain in contact with our employees and union leadership. As the understanding of COVID-19 increases, we expect to take additional required measures." But flight crews and essential service are falling ill. Their union says they're at risk and putting travelers at risk. Canada's federal COVID leaders are scrambling to keep up, their advice constantly changing.
And so we continue to work with sectors to refine that guidance as we uncover various aspects of their work.
We asked whether Ottawa will enhance protections to require flight crews to wear protective suits. Federal officials declined to answer. Dave Seglin, CBC News, Toronto.
Construction workers are also raising the alarm about on-the-job safety, especially in Ontario, where the government calls their work essential. Chris Glover shows us why some feel their safety is being sacrificed.
I don't care. I don't give a anymore because I'm scared too.
The fight to halt Ontario construction is getting personal.
My wife is crying every time I go home because she doesn't know I'm going to kill her father if I have something.
This union rep tells me he didn't know he was being recorded, but says laborers are at risk during the pandemic.
You guys don't have 6 feet around you. We're all breathing on each other. Where's your eating facilities? Are they sanitized? You have water to wash your hands when you eat your sandwiches?
That speech right there, that could have happened any job site, anytime over the last 20 years.
Plumber Terrence Haynes says COVID-19 is shining a spotlight on shoddy conditions. He was just laid off.
A layoff is something that you really hate to receive, but actually I was kind of thankful for it because they made a decision for me.
Unlike in Quebec, where the government stopped construction, Ontario Premier Doug Ford says shelter is essential, and so is construction.
If the workplace, the construction site, is not safe, you can walk off the job.
Doug Ford says walk off the job if you feel unsafe. It's not that simple.
This electrician reluctantly walked off the job. The single mother worries EI won't be enough, but says her hand was forced.
They make us sign a form saying we'll wash our hands, and it's like we're laughing. We're like, where are we going to wash our hands? Where are the sinks?
Roughly 45,000 people signed a petition to shut down all Canadian construction sites, while some companies have shut down on their own.
It would be better to suffer for 15 days than possibly dragging this for months to come.
Some might think being considered essential is a compliment.
I hear the word essential, but to me, really what you're saying is we're expendable.
He says workers are being sacrificed. Chris Glover, CBC News, Toronto.
Of course, healthcare workers are on the front lines, working long hours under difficult circumstances, and they are seeing the harsh reality of COVID-19. Some, like Jenna Meloche, are also speaking up. The Canadian nurse works at a Detroit hospital. She posted a plea on Facebook today, urging people to take this threat seriously. Here.
I think that a word that everyone loves to use is unprecedented. It's frustrating to be a healthcare worker and to see what we see and see the suffering and the death when we go to work, to see people treating this just like any other time in history. For us, I think that the most difficult thing to see is the patients that do not have access to their family members. A family member said to me, I want you to go into my husband's room and I want you to just say in his ear that his family loves him and we miss him and that just be strong and get through it. And that is something difficult to have to convey to a family member who can't be there. And a lot of our patients die without the support of their family around them.
COVID-19 is cracking the bedrock of the Canadian economy. For some small business owners, it's no sales. For their employees, it's layoffs and no pay. Today, the government acknowledged it's not doing enough and announced a new subsidy to backstop up to 75% of wages. Evan Dyer has the details.
We're going to wrap up operations for the time being.
Another business shuts its doors.
We just decided not everyone was going to continue to be comfortable working in this situation.
While others struggle on.
I said to my team, I will pledge to pay you. I don't want you to have to go on unemployment insurance, so I will pay you.
But nearly all agree the government's initial offer to subsidize wages at 10% was not enough.
That's not going to cut it. It's not going to be significant enough for employers to be able to hang on to their workers to ride out the economic crisis that's coming alongside COVID-19.
It's becoming clear that we need to do more, much more. So we're bringing that percentage up to 75% for qualifying businesses.
It's an approach taken by many European countries. Canada's wage subsidy is somewhere in the middle of the pack, which runs from 60% in Germany to 90% in Sweden. Phyllis Bright's flag store in Edmonton is closed, but she decided to keep paying her 3 employees out of her own savings.
I have to admit, when I did my payroll on Wednesday, I was very depressed. When I heard it at 9 o'clock our time this morning, I was ecstatic.
This store was ordered to close on March 24th, and for its owners, the new change won't be enough.
When we got the announcement, unfortunately, we did lay off the staff. We had to choose to do that.
Today's announcement won't bring them back.
We are still looking at other measures that the government has promised, but the details are still TBD. I'm hoping that over the weekend we'll hear more, and that will change, hopefully, our stand.
Today's change has been widely welcomed. Wages are the biggest expense for most small businesses. Next week, though, many face another big challenge. Rent comes due. Evan Dyer, CBC News, Ottawa.
Canada's response to the crisis has included fiscal policies like the one Evan just talked about, but it's also seen aggressive monetary policy from the Bank of Canada. David Cochrane looks at the latest in this two-pronged attack.
The needs are so numerous and so urgent, the finance minister says there is no financial limit.
I will tell you that we have not put a cap on what we might need to invest to solve this problem, to make sure that we protect Canadians.
So on top of the enhanced wage subsidy, there's $95 billion in additional help, including interest-free loans of up to $40,000 for small businesses, $10,000 of which can be forgiven entirely. There's bigger loans of up to $6.25 million to help businesses with operations and cash flow, and no payment of GST or customs duties until June. In less than 2 weeks, he's poured more than $200 billion into the fight against COVID-19.
So it's very significant. It is entirely possible that we will need to make it more significant.
It was a 1-2 punch from the Minister of Finance and the Governor of the Bank of Canada, who cut interest rates again to just 0.25% and promised to pump $5 billion into financial markets each and every week until the economy is in recovery.
Some may suggest that this is using a lot of firepower, but I think that a firefighter has never been criticized for using too much water.
Extraordinary measures for extraordinary times, trying to keep money moving in an economy in lockdown. David Cochrane, CBC News, Ottawa.
As we try to manage the virus, different provinces and cities are facing different challenges. Anita Bath is tracking stories from communities across Canada for us tonight.
Ian, we're taking a look at the Atlantic provinces this hour, starting in Nova Scotia. 17 new cases for a total of 90. The Chief Public Health Officer says he's troubled by reports of harassment toward people with COVID-19.
I've been made aware of a few cases where people who have been tested positive for COVID-19 or their contacts are being harassed in their community, are being harassed on social media. That is inappropriate.
In New Brunswick, 2 men have been arrested for not self-isolating after returning from international travel. They're also alleged to have deliberately coughed on someone. There are now 45 cases of COVID-19 in that province. And 2 new cases in PEI today, totaling 11. We're also learning schools in the province will be closed until May, so home-based distance learning is now being looked at.
Recognizing that there are significant challenges with that depending on where you live. We're trying to, as much as we can, individualize some of the learning plans as well.
And cases topped 100 in Newfoundland and Labrador. 1 person is in hospital. More than half the cases are related to a service at a funeral home in St. John's last week. Ian?
All right, Anita, thank you. CBC News has been tracking every confirmed case in Canada. You can check it out online, cbc.ca/coronavirus tracker. New York is urgently building 4 temporary hospitals to deal with a rising tide of COVID-19 cases. Up next, a haunting look at the war doctors are waging on the front lines. Plus, more of your great questions about COVID-19 put to our experts, including how long can we expect this to last? And distant but social.
Everyone loves a good old Nova Scotia kitchen party.
Throwing open the virtual doors to stay connected the Nova Scotia way. We're back in 2. Welcome to our viewers on CBC Television in British Columbia. The number of cases of COVID-19 in the United States has now surpassed 100,000, more than any other country. Hospitals in U.S. hotspots like New York are desperately short of supplies. Today, the U.S. president invoked the Korean War-era Defense Production Act to compel manufacturers like GM to make ventilators.
We will not hesitate to use the full authority of the federal government to combat this crisis.
Trump also signed the U.S. relief bill worth $6.2 trillion. Drive-through testing sites and temporary hospitals are going up across the country, including at a place which invokes memories of another crisis years ago, the Convention Center in New Orleans. Nearly half of the cases are in New York, where more than 6,000 people have now been hospitalized with COVID-19. That's double what it was just 3 days ago. And New York's governor says the worst is still ahead.
We're looking at about 21 days for a possible apex. So we want to do everything we can to be ready.
Here's Stephen D'Souza with a glimpse behind the front lines in New York.
Who's the sickest patient used to go up?
Patients piling up, frustration building. New Yorkers are posting on social media the dire situation on the front lines.
It literally is like a war zone, and everyone is in it, in the trenches together, and we have to rely on each other.
For Dr. Tanzib Hussain, the shock wasn't the initial wave of patients at his hospital in Brooklyn. It's what happened next.
All of the patients that initially came in, now 4 or 5 days in, they're all, to put it in the clearest way, they're dropping like flies.
He says almost all of the patients he's seen on ventilators have died. Final conversations are solitary affairs. Patients are kept alone. No visitors allowed.
So going to these patients and telling them that this might be the last time they're awake, that's very tough. And I think that's what impacts the physicians that are on the front line, the nurses in the front line, more than the numbers or the fact that we're overwhelmed.
Supplies are limited, so hospital staff are making do as the emotional toll adds up.
Each shift, every shift I've worked, I've cried after leaving from the shift. We are doing everything that we can to help everyone, to see everyone, to treat everyone, but we have limited resources.
We do have some progress.
The mayor says supplies are coming, and Dr. Hussain welcomes the temporary hospitals being built. But woven into their work, the fear that they'll fall sick next.
Because it just seems inevitable to us. But we're doing the job because this is what we signed up for.
And his warning for the rest of America, New York is a preview of what's to come.
People are not recovering at a rate that we would hope. We don't necessarily have adequate treatment yet, and the hope is that that's going to come. But until we have that, patients are getting sicker, they're staying sick, and it's serious.
At one overwhelmed hospital in Queens, a message of thanks as doctors across the city dig in, knowing the worst is yet to come. Stephen D'Souza, CBC News, Toronto.
The spread of the virus is still exploding in many parts of Europe. Italy experienced its deadliest day since the outbreak began. And in the UK, the nation's leaders are being struck by the virus too. Margaret Evans is there.
The British capital, waking to day 4 of a nationwide lockdown and news that the Prime Minister, Boris Johnson, has tested positive for the coronavirus.
I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough.
He wasn't alone. The health secretary was soon tweeting that he too had tested positive, and the government's chief medical advisor is also now showing symptoms. That left it up to another senior minister to answer questions about a government potentially not practicing what it preached.
The virus does not discriminate. We are all at risk, and that is why it is so important that we practice social distancing measures.
Johnson appeared in Parliament on Wednesday. His diagnosis follows that of Prince Charles, last seen in public with the heir to the British throne on March 9th. Johnson delivered his last weekly briefing to the Queen by telephone, and Buckingham Palace has said she remains in good health. The news comes as Britain is bracing itself for what it fears will be a sharp rise in the number of cases, the pain of other nations spurring preparations. In Spain, quarantine means the dead are often buried alone, the living unable to visit those sick in hospital.
People get sick alone, and they die alone, and they are buried alone, and you cannot do anything.
In Italy, more than 900 people have died over the past 24 hours alone. Today, the Pope, a lone and dramatic figure in St. Peter's Square, delivered a global blessing. For weeks now, it has been evening, he said. We have realized that we are on the same boat, all of us fragile and disoriented. It was time, he said, to row together. Tonight, Ireland became the latest country to impose a lockdown. The Prime Minister warning that intensive care units could be at capacity within days. Margaret Evans, CBC News, London.
Next on The National, our experts tackle your tough questions like, can quarantine Canadians take their dog for a walk? Plus,
I'm saying don't come to Canmore for now.
Clash in cottage country. Small towns say to vacationers, stay away. But first, as we go to break, another reminder of what's been lost in the lockdown. That thing Canadians do so well, show up together. Welcome back. It's time for our nightly COVID-19 question and answer session. On this edition from Toronto, respirologist Dr. Samir Gupta, and in Halifax, an infectious diseases physician, Dr. Lisa Barrett. Welcome to both of you. And Dr. Gupta, let's start with the first question to you. How long do pandemics usually last, and how long can we expect this one to last?
Okay, so if we look back, we usually would have 2 or 3 pandemics every century.
The last one we had was in 2009, and that was the swine flu pandemic. And typically they'll last 12 to 18 months. Now the challenge with extrapolating, though, is for a couple reasons I think that's risky. One is that these pandemics are usually mutated flu viruses, and this one, as we know, is different because it's a coronavirus. The other is, I would say, the world is a different place. So in terms of how fast it's spread, there's a lot more domestic air travel now than there was even 10 years ago. And then the other is on the mitigation side, the kinds of strategies that countries all over the world are now undertaking are probably more extensive than anything that's ever been done before. So hard to compare timelines.
Dr. Barrett, is there at least some kind of measure that you and your colleagues are looking at to know when we've gone through the worst of it?
Generally, during any infectious disease outbreak, we watch to see when the most cases in the shortest amount of time happen. And so we do a curve to look at when the curve is going up and when we reach the peak as we slowly come down on the other side. So the number of new cases per day, per week, per month, when that starts to go down reliably over multiple time periods, so multiple days with fewer cases, multiple weeks with fewer cases, that's when we start to think that if we keep up with our mitigation strategies, as Dr. Gupta just mentioned, that we may be on the end of the first wave.
Even as you describe that, it sounds nice to hear something that we can look forward to, hopefully, if we continue these measures. Dr. Gupta, next question to you. With the 14-day mandatory quarantine for returning Canadians, are they allowed to leave their house to exercise or walk their dog?
I would say that the quarantine really is in place to protect others. So if you're returning from travel, by definition, you are at high risk. So you really need to respect that quarantine. You can go out in your own space, in your own backyard for a walk, but I would ask people not to actually go into public spaces or even onto the street while they're in that 14-day quarantine period.
All right. And Dr. Barrett, last question to you. When a person is an asymptomatic carrier of COVID-19, how long are they contagious for?
When people don't have symptoms, they are minimally contagious to other people because they're not sneezing or coughing or spreading droplets. However, we do know the virus does shed for some time. What's not clear at this point is whether you're contagious after you've had symptoms and recovered and are shedding. So right now, that 14-day incubation period before you get symptoms should be very, very respected.
We have less than a minute. I want to quickly ask this question to each of you. And Dr. Gupta, I'll start with you. What's the mood like in your practice in your city right now?
Well, I had a clinic today. It was a virtual clinic. I did it from home in my pajamas, so that's sort of the new reality. My patients pretty much all asked me what would happen to them if they got this infection. My patients have respiratory diseases, so people are worried, people are scared.
Dr. Barrett in Halifax?
We're just starting to see a ramp up in our numbers here in Halifax, so we're a little behind Toronto. People here have generally been pretty good about staying in. There's a lot of worry and concern, but my patients have been very good about doing virtual visits and really supporting each other and actually reaching out to healthcare workers to support them and tell them they appreciate what's being done. So lots of planning and lots of appreciative people who are staying home. They're staying out, staying in and not going out, which is really very much what we appreciate.
And we appreciate the time that each of you are taking with us tonight. Thanks very much.
Anytime.
And as you likely have been seeing, we're asking your questions about COVID-19 each night. So send us questions on Instagram at CBC The National or by email, covid@cbc.ca. Just make sure to put The National in the subject line. Summer cottages are supposed to be a place to relax, but during this crisis, they've become a source of tension across the country. Whether you call them camps, cabins, or chalets, some owners are using them to self-isolate. Carolyn Dunn shows us why that has triggered a backlash.
It's easy to understand why anyone would want to come here, but check out what happened last weekend when they did. Not exactly physical distancing.
It caused anxiety and concern levels in our community to just skyrocket.
So Canmore's mayor is saying what he never imagined he would.
Usually I'm standing here welcoming people to come and enjoy our beautiful town in the mountains. I'm saying, don't come to Canmore for now.
With nearby national parks closed, there are fears the small town simply can't handle visitors and the coronavirus risk they bring with them. In Ontario's cottage country, the issue is people coming and staying weeks before the usual summer surge. Huntsville's mayor was one of several who tried to ward them off.
While we are all in this together, there are issues with the increased population at a time when we are not prepared.
Many cottagers resent being asked to stay away from second homes they pay taxes on, but concerns go beyond limited food and supplies during the off-season. Healthcare services are still very much at small town levels.
What I would encourage people to think about is when they're making that decision, consider what healthcare is there and what that may mean for them depending how the pandemic unfolds.
Some people on social media have lashed out at those who keep coming. I guess people didn't get the memo to stay home, one wrote. You are infecting mostly poor, elderly people who have little health infrastructure, another vented. You could kill my entire family. The message to people who are sick and tired of staying home, stay home anyway. Carolyn Dunn, CBC News, Canmore, Alberta.
Still ahead on The National, how a family of refugees who came to Canada 4 years ago are paying forward their sponsors' kindness. Plus,
just sit down and talk to me a while.
Come on in, your invitation to a virtual kitchen party. Charities are suffering financially from this crisis. The government says help is coming, but for now, some are being forced to lay off staff. Alison Northcott now on how COVID-19 is changing the way they operate.
Lining up for a hot meal, standing apart outside where they would normally be welcomed in.
This is our lunchroom at the Mission. We usually have 50, 60, 70 people. but obviously it's empty right now.
This mission has changed the way it works to prevent the spread of the virus.
A lot of things we had to cancel. We're keeping our focus only on food, the provision of food and whatever emergency services that we can provide.
Charities across Canada say they're facing an unprecedented challenge with COVID-19, with cancelled food drives and fundraisers, and in some cases a drop in donations and a shortage of volunteers.
We've certainly never seen anything like this before, the way support has just suddenly stopped. I'm fearful that it risks hollowing out the charitable sector.
UNICEF is part of a coalition of charities asking the Prime Minister for help. They want a $10 billion stabilization fund to prevent organizations from suffering irreparable damage. This nonprofit collects and sells clothing donations, but its stores are now closed and 850 employees temporarily laid off. Big Brothers and Big Sisters in Halifax is also unable to collect and sell clothing, but is still trying to maintain connections like this.
Hi, London. Hi, Sissy. I love you.
Volunteer Big Sister Caitlin Lees and her little sister London Gorey.
London turned 11 a couple days ago. This was the first birthday we've had together in a while, and I couldn't give her a hug. I left her a present on her doorstep and waved at her. And
it was nice, but it was like a little upsetting because I couldn't give her a big squeeze.
Quebec's premier is encouraging healthy people under 70 to see if local organizations need volunteer help, as many charities appeal to Canadians to donate if they can. Alison Northcott, CBC News, Montreal.
As important as the community benefit is of physical distancing, there's a group of people for whom it brings huge personal risk. Victims of domestic violence know isolation is a tool their abusers can use. Ellen Morrow looks at a consequence of COVID-19, hiding in the shadows.
In a crisis, home for many is a sanctuary. For others, it can be a prison. A prison made darker when the usual escapes are suddenly cut off.
Growing up in an abusive home, I would say that being unschooled and with a jobless parent, it was a really scary and hopeless situation. There was no hope that they would, get up and go to work the next morning, and now you're going to be safe.
Rifa Carter is a survivor of family abuse. Now an advocate for women facing domestic violence, she says COVID-19 has created a perfect storm.
I'm constantly reminded of what it would have been like for me if I was them. All the red flags are going to be missed.
With businesses closed and schools shuttered, there is little refuge for those facing abuse at home, little interaction with others outside, and that worries advocates.
Isolation is the first thing that an abuser will do, is keep them away from family and friends. So this is an abuser's dream to have control over that person.
And with so much shut down, they may now feel like there's nowhere for them to go. Women's shelters are still open and counseling services are available, but they're under pressure, trying to practice social distancing while expecting demand to rise as the pandemic goes on.
To help, the government pledged $50 million in its recent aid package.
We're all kind of contending with some of these really challenging times ahead.
Marlene Ham's agency oversees dozens of Ontario women's shelters. She says no one has been turned away, but challenging times mean difficult decisions.
We've had to look at kind of going down to what's most important, and that is women who are in imminent danger.
Many organizations are putting COVID-19 resources online, including safety plans for isolating at home with an abuser. Deepa Mattu leads a legal support clinic for women experiencing violence.
When they're alone and locked into the house with their abusers, there is potential for escalation.
And anxiety over the pandemic only makes it worse.
Women are fearful of leaving. They're very scared of uncertainty around them.
With so much uncertainty, Rifa Carter says contact, even from a distance, has never been more important.
I would really encourage people to reach out to those they know are experiencing domestic violence. Just don't look the other way. If you hear something, call for help.
It may make all the difference. Ellen Morrow, CBC News, Toronto.
Next on The National, when they came to Canada, things looked different. Now these foreign students are, well, they're stuck. We help them find a bit of community next. They're not only isolated from fellow students, they're also away from family. International students are sharing their stories amid this pandemic. As Natalie Collada found out, many are concerned about their status, their finances, even losing their home.
Hello everyone, I'm Diego Palacios, and this is my 6th day of self-isolation.
Diego Palacio is one of more than 500,000 international post-secondary students in Canada, trying to cope in the middle of a pandemic, thousands of kilometers from home.
Just to have my mind somewhere else, I just have take a walk after lunch.
He's now also social distancing and is worried money is running out.
Mid of May won't be enough to pay all my expenses.
We asked international students across the country to record video diaries, sharing their concerns about life here and family back home. And how are you feeling?
Kind of stressed at the moment, and maybe a bit powerless.
Many students living on campus are now scrambling, like Alex Lau. Across the country, universities and colleges have closed residences. Concordia University gave Lau extra time to figure out where to go.
My parents are in Italy, and I can't like join them.
Some schools are making exceptions for international students.
Good morning, guys, from Vancouver.
Syed Ahmed arrived to start a new program just days before Canada shut its borders, only to learn his classes are now online.
I'm definitely a social person, and if I had to take an online class, I could have done it, in Dubai.
Vinita Bhatt hasn't seen her family in Tanzania for 2 years and doesn't know when she'll be able to see them next.
It's a big struggle, and I miss them a lot.
To combat that loneliness, we hosted an online video chat with some of the students.
Alex, listening to you that your family is in Rome, I know that for you will be really, really, really hard.
Thank you, it means a lot, actually.
Assuring thing is that we're all in this together.
And that, they say, helps. Natalie Collada, CBC News, Toronto.
Nice idea. Still ahead, returning the favor 4 years later. They were in self-isolation and needed groceries. We'll tell you who came to help in our moment. But first, bringing a Nova Scotia tradition to life during the pandemic. How a simple call out for music quickly became the ultimate virtual kitchen party.
This is Pineville, Nova Scotia Part 2 Kitchen Party. Hope you enjoy.
I'm coming to you from Cole Harbour, Nova Scotia.
Because you guys were having a little kitchen party. I figure I gotta bring the Maritime to the party, right?
Hello, everyone. Live from my living room again.
Everyone loves a good old Nova Scotia kitchen party. This is giving them a sense of community, maybe even finding some new friends. And I'm so very thankful that the group has had such a positive response and that we're able to bring a little bit of joy to people and a little bit of a distraction when I feel like we need it most.
We never want to see the sun go down.
Enjoy. Stay safe.
CBC Listen. Hear it all here. Download today.
Travelers returning to Canada are being told to self-isolate for 2 weeks. But what happens when you head home and there's an empty fridge? A family in Victoria recently returned from a trip to Mexico. They found themselves in that situation. But thanks to a refugee family they sponsored back in 2016, they came home to a generous surprise. And that is tonight's moment.
A couple days after we got back, I got a phone call, and it was my friend Marwa, who said, you know, I'm outside your house. So I walked over to the window and looked out, and she kind of backed up to the sidewalks. I didn't want to open the door and be too close in case we had been exposed during travel. And opened the door, and she had put 7 bags of groceries on my front steps. They knew that we weren't able to go out and go shopping, so they brought bags and bags of groceries, everything from canned goods to fruits and vegetables, candy and cookies for my kid, just a huge amount of food. And I was just very, very moved and very surprised and touched. And I think often people think of Canada accepting refugees as something that Canada is doing to help other people, but it's such a mutual relationship, and Canada benefits so much from the people who come here.
I know so many families who have enjoyed giving to refugees who have come here and trying to get established. And I'm sure for those refugee families, it must be a real pleasure to have an opportunity to give back. They own a grocery store now, by the way, that Syrian-Canadian family on Vancouver Island. That is the National for Friday, March 27th. Good night.